I call upon Dr. Ganesh sir, Scientist E, Deputy Director, Head Division of NCD, to deliver a speech on cardiovascular health of young India.
I head the Division of Non-Communicable Disease in Indian Council of Medical Research, National Institute of Epidemiology, and also the Deputy Director of ICMR. I should really thank, I'm also a member of Indian Medical Association. I really felt a guilt that when Dr. Abdul Hassan has mentioned that you need to do some activity along with an IMA. But I haven't done that along as part of IMA, but I've been doing it. So maybe all those work could be acknowledged as part of an Indian Medical Association member. But I wish to expand it. I've been in having close conversation with Dr. Hariharan. I really want to thank him that he has introduced me to this amazing group of people who is going to make a huge amount of change, and why you could see the forthcoming slides when I'm describing it. This is one startling question that every one of us should think about it, which means how to prevent thousands of cardiovascular deaths in the next 5 years. Why does it matter? Is it really, you may be hearing a lot of news here and there, especially young doctors, at least for us, that many of our friends have left, and without completing majority of their duties, left their families, left their friends, and it is a severe loss to the nation also, apart from the family. You never know how much amount of investment goes onto a doctor to groom himself so that he is going to save out to the society. If you see this particular slide, the number one killer across the globe, even in India, every year you could see 20.5 million. You could see that's a number of deaths due to cardiovascular disease, and you can see that the rest of the other are much lesser: cancer, respiratory disease, HIV. And if you see here, there are every year 20.5 million deaths are happening across globe. 75% of that in lower middle income country. When I say death, there is one important term which you come across, something called premature death. Can anyone of you please tell me what is that called? Premature death. Anyone who is dying less than 70 years. And that is very high in lower middle income country. And when you see here, 33% of all these global deaths are contributed this particular factor. To be very honest, I'm a public health researcher, public health advocate, closely work with the health system. I generate evidence, we generate evidence, we present it to the policymakers and practitioners to make an impactful change in the ground. Apparently public health, how it works, when we just put it, our 100% of it, 2% will come into practice. The evidence says that whatever the evidence is there, it will take nearly 18 years for that evidence to come as a practice. This is the truth. Now how to accelerate it is these kind of programs. I'm believing it, and I have the wish that all these matters should get accelerated, and they should also get disseminated from you. As I said that, many of the office bearers have clearly mentioned that you as a sharing, which means you need to communicate this strongly to everyone. What to communicate? Why I am just talking very, very important. This is an important issue. If you see here, I don't know whether it is visible to you because the visibility has gone down. I don't know whether it is. If you see here, this is death rate from cardiovascular disease in 2019. Is it possible to make it little big? I don't know why the slides have shrunk. I don't know. Fine. Okay, right. We are in the very high. If you see that LMICs, majority of them, and especially Southeast Asian region, the death rate is very, very high. Okay. I will assist you to understand it because it will be difficult for you to assimilate what is happening in these slides. What I am trying to show you here is that number of death by different causes. This is something, and I'm an epidemiologist. In epidemiology, we say something called cause-specific mortality rate. And in that, when we come down to cause-specific, cardiovascular disease is very high. And you can see the difference from cardiovascular. Okay, if you see that from cardiovascular disease, the next is respiratory disease, the difference is there. Then you may need to understand that what is behind this cardiovascular disease. This is the trend of the total disease burden in the world from 1990 to 2019. We had a major problem, something called communicable disease, which is infections. Now it has come down. And you could see that the cardiovascular disease, NCDs, are increasing more. And the same when you see that in India from 1990 to 2019, you could see that it is still increasing. Overall, if they come across everything that the cardiovascular mortality overall averaging out in the world, it is little bit dipping. But when we do a stratified analysis, in lower middle income countries, it is increasing. This is reverse. This is the one important thing we all need to ponder about it, why this is happening. This is India. In 1990, these are the top causes of disability adjusted life years. In 1990, it was diarrheal disease, lower respiratory infections. In 2016, it is ischemic heart disease and diabetes. Next it comes. I'm all routing all your thoughts to one important matter here is that what actually is causing these kind of number of deaths, especially young deaths. When I say this young deaths, these are the most important causes of cardiovascular death. Just to see these numbers, this is based on this source is World Heart Report released by World Heart Federation 2023. The number one cause is raised blood pressure. Number two, you may be thinking different, but it is air pollution. I think Dr. Abdul Hassan has mentioned what we are doing in terms of climate change. You are not going to change the climate, but you need to do some activity in terms of reversing the impact of that climate over your health of the people. One important thing, in environmental epidemiology, they mention something called green environment. Whether your workplace is having the green environment, whether your house is having green environment, whether your patients are treated in a green environment. Huge amount of literature supporting it. Even green environment has impact over pregnancy outcomes. So this is something that which you can all think about it. But I want you to bring your focus on raised blood pressure. Then comes your LDL, then comes your tobacco, then comes only your high fasting plasma glucose. We do national NCD monitoring surveys in 2017 and 18 and we are going to repeat it again. We did for Tamil Nadu also steps survey. What we found, one important thing here is that the awareness on hypertension is very, very low when compared to diabetes. Diabetes is glorified very well thanks to the many industries because they glorify diabetes very high. But apparently hypertension is not, because that is the number one killer. If I honestly ask, I've been training, I will talk about that under what program we have trained. I've been training doctors and nurses and pharmacists on hypertension. I found an important thing. Their awareness on what is a cutoff point for control is very abysmally low. Whereas they are much aware about diabetes. Hypertension is neglected disease. That's what I see that. This is a very, very important fact which is released just in 2024, it is published, the first quarter of this year. These are the top killers of young deaths, 15 to 39 years. Age standardized mortality by each risk factor. I will help you to read that. The number one is hypertension. The single best indicator is systolic blood pressure. The number two comes, I can pass it on here, the number two is high body mass index. Then LDL cholesterol. Then ambient particulate matter pollution, which is nothing but environmental AP, which is climate change, pollution. Okay. Then comes smoking, alcohol, then diet low in whole grains. You can keep on going that. Your high fasting plasma glucose is very, very less. So the most important matter which you need to really think about it here is that you may be thinking that diabetes is one important, but we are neglecting sincerely about hypertension. Repeatedly, even for young adults and as well as older adults, for all adults, it is the number one killer. But we have not done much about it, which I am going to tell you. So this is a silent killer. It does not exhibit any signs and symptoms. I assume that the target population sitting here are 30 years or 25 years and above, there are even 20 years and above. Okay. All are coming under 18 years and above. Every fourth person will be hypertensive. I'm sorry. I want to be. Even I had a tough conversation with my Director General that he said we need to reverse hypertension. I said we can't. This is epidemiological transition. Every fourth person sitting in this room will be hypertensive and we are not doing nothing about it. Why? I will just show the next important part of that. India is the world's one country which is highest number of hypertension. 20 crore hypertension are living in India. People with hypertension. 20 crore. But I am just going to convert those numbers into different. This is the results of our survey. Of the 20 crore hypertensives, which you can see, this is the people with hypertension. Only 28% are diagnosed that they are having hypertension. Okay, this is called cascade of care. Okay, which means they are aware they are having hypertension. But of that, all the hypertension, only 14 are under treatment. Please understand, 85% are not under treatment. They are not under treatment. What happens to them? What do you expect? You expect what, an LED TV to be delivered? What do you expect? When you are having a high blood pressure and it is over a period of time, it is hitting your endothelium very hard, along with other risk factors which we carry genetically, along with other lifestyle risk factors, which we have high salt diet, which we have less intake of fruits and vegetables, which we have less physical activity, which high BMI, obviously you will expect a lot of cardiovascular deaths among young population. or what we need to do to prevent the heart attacks? That's my simple question. I'm asking this question. Anything that you want to? The thing is, the answer is here. You need to first diagnose more. Do we need a very sophisticated diagnostic equipment? Do we need a CT angiography for diagnosing hypertension? No. We need good quality blood pressure apparatus, which is not there. Again, I'm saying, I bet you that if I am going to show some fact that you can introspect yourself, do you really have a professional blood pressure apparatus in your clinic? Not many of them. The most worst part is that only 12 out of 100, which is 1 in 10, are only under control. 90% are not under control. Naturally, they will land into all vascular morbidities and mortalities. I'm talking about the number one silent killer. Now, this one activity which I would request all of you is that you can think of doing about it. I'm sorry about the AV here. I'm sorry about it's not looking good. Ideally speaking, it should be a very important diagram that you all need to see this. If you see here, the y-axis is age in years. This is published in 1963 in one of the textbook. This talks about your endothelium, where it will land up into an clinical angina. The life cycle approach tells us that your endothelial damage and as well as heart attack starts much younger age group. The thromboembolism starts very much younger age group, which means even it starts around some 10 to 15 years, adolescent. And then it slowly gets damaged. That's one important thing we need to see about it. I'll take a minute, okay? So we have one epidemiology, we say something called population attributable risk factor, which we say that if you have to do something on something else, you can reduce how much times of the death, the outcome. That is called PAR. What all you are seeing here is that population attributable fraction of all important risk factors for cardiovascular death. When we see that there are many things which you cannot be able to do per se, which you can't stop, like age, you cannot be able to do much on a very huge amount of an impact on alcohol. You need an individual interpretation, individual counseling has to be there. Smoking is reducing, dipping, fine. But see the number, all these top risk factors. I just want to highlight lipids, hypertension, diabetes. Why I am highlighting is that these are all having proven interventions which you can immediately identify and do it without any major cost. For smoking to reverse it, you know how much it is difficult. For alcoholism to abstain it, it has to have huge amount of measures to do that. And as well as when you want to do a kind of mass scale amount of a physical activity to reduce your obesity on all things, again it is a difficult part of it. This is a major problem which I have with every other crowd. They challenge me, one thing is that, are you saying that to treat everyone with the drugs? I say, I don't have any other option. Do we have any option for tuberculosis? Do we have any option for malaria? Do we have any other option for any of other intervention? When pharmacological intervention comes to cardiovascular death, they always stick to yoga. They always stick to physical activity. But in next 5 years, you cannot prevent any deaths. What actually the science is that if you reduce 1 kilogram of body weight, 1 millimeters of mercury of systolic will reduce. That's the evidence says that. In order to reduce 10 millimeters of mercury, you need to reduce 10 kilograms. So something we need to do for that. How to do this? If you start treating nearly say 1.2 crore hypertension, I told 20 crore hypertension are there. Of that 20 crore, nearly 18 crore are undeducted, okay, in India. If you start treating 1 crore hypertension, and what you can prevent in next 5 years is 75,000 deaths. In next 10 years, 1.5 lakh deaths. And in next 5 years, 2.5 lakh heart attacks. It is simple, like I am taking in terms of PMJ scheme, 1 lakh for treating an heart attack versus 200 rupees to treat one person for the whole year. Just it takes 200 rupees, nothing more than that. And there is one drug which we found in our very big initiative, which is called India Hypertension Control Initiative. Amlodipine 5 milligram, 70% of people brought under control. That's it. It cost nearly 10 paise in mass scale purchase. One tablet, 10 paise, that's it. But what actually we need to do? We need to measure them and identify it. I am the principal investigator of this project currently. And now we have seen 5 years, we have implemented that in 145 districts in 26 states, where we have treated nearly some 46 lakh patients through the government health facilities. We found there are important learnings from that. And these learnings, one is, we need to start adopting protocol-based treatment. This is a simple protocol. 26 states have implemented it. I don't know in private. This I have been talking very closely to Dr. Hariharan that like, we need to disseminate this particular fact. All these are available in ihca.in website free. You can see the protocol, you can see the checklist, you can take care of everything. All are evidence-based protocol. It starts with the amlodipine, goes towards telmisartan, and ends with the chlorthalidone. 3 drugs, that's it. To take even the 3 drugs, it takes only 200 rupees to treat a person for a whole year. And that's as simple as it is. And you cannot possible to treat this much number of people only by an usual approach of doing all kind of other barriers. There is something which I mentioned called professional blood pressure apparatus, which we need to start purchasing and doing it. And where can you find professional BP apparatus means it has either of these 3 validation protocols. It should have any of these 3 validation protocols. And you want to check in your market which is having professional BP apparatus, go to this website stridebp.org and you can see those professional BP apparatus are listed there, and you need to purchase that in order to use it in your own clinics to start identifying people with hypertension. That's my simple plea that which I am trying to say. We also have a kind of a free software where you can track patients because lifelong treatment is going to be there. And most importantly, all these resources are available in ihci.in. So the answer here is how you can prevent in next 5 years some cardiovascular death is please treat hypertension. Thank you very much.
Thank you, sir. Now I request Dr. Hariharan sir to felicitate Dr. Ganesh Kumar sir as a token of our gratitude.